It's the third leading cause of death in Canada. 14,000 Canadians die each year. It's the number one cause of long-term disability in Canada. More than 3,000 people in Saskatchewan suffer a stroke each year, often leaving them disabled. Too often, people die.
This, I think, is an underestimation of what this costs society and what it costs the healthcare system, but $3.6 billion a year for this. 3-year history of having major psychiatric issues, but he was previously healthy, normal man. This is why it's important, is because the people that are presenting often are presenting with terrible, very dramatic problems, and if we can't get them state-of-the-art, cutting-edge therapy, often they will succumb to this.
But the chances have improved for most people suffering stroke in Saskatchewan. The Stroke Program at Royal University Hospital, consisting of neurosurgeons, a stroke nurse, and neurology staff, has helped give people that better chance.
Currently, the approved standard of care for ischemic stroke is IV TPA, and there's an overwhelming amount of evidence that tells us that the sooner you can give this clot-busting drug, the better the outcome it is for our patients.
The Stroke Program ensures patients receive prompt care. When Emergency Medical Services is transporting a stroke patient, the hospital is alerted and the stroke team is on standby. All the medical history is made available to the team prior to the arrival, and when the patient arrives, the team kicks into action. The care provided to the patient takes place in the vascular suite. However, the equipment has been outdated and needed to be upgraded to ensure the technical aspects of the care match the speed and proficiency of the care team. The Royal University Hospital Foundation has helped make this happen. A foundation-led campaign has raised more than $1 million. The province of Saskatchewan has committed $2 million. All to allow Saskatoon Health Region to improve these facilities, to save lives, reduce healthcare costs, and provide people with a greater chance of recovery from a stroke.
On August 15, 2013, I was diagnosed with a supercellular, gigantic supercellular brain aneurysm.
When I received the phone call that my husband had a mass on his brain, I was speechless. I had answers. I finally had an explanation as to why his behaviors had changed. When I met with the doctors, his prognosis was terminal.
I was transported from Regina to Saskatoon's RUH hospital, where I met Dr. Peeling, Aaron, and the rest of the team. They accepted me as a patient and began treatment for my brain aneurysm. I didn't fully comprehend the situation at the time.
Leonard suffered with short-term memory loss. He wandered away a few times not knowing where he was, and he was extremely tired.
On September 3rd, I had the first of 3 surgeries. This is where the programmable VP shunt was implanted.
On September 6th was the big day. We had the entire extended family up to support us. I kissed my husband and told him to fight hard. He hugged the girls, and we turned him over to Dr. Peeling and Dr. Kelly's miracle team. Around midnight that night, I got to see my hubby again. He could wiggle his toes, he could talk, he could smile, and he was starving.
And we got to cuddle our daddy.
Fast forward a year, and I have come leaps and bounds from the side effects I had. I no longer struggle with behavioral changes, extreme exhaustion, or wandering. I do have some impairments, however they are minor in comparison. My brain is still healing, but I am expected to recover fully.
Leonard has visited the angio suite close to 10 times, and he will continue to have follow-ups to ensure his aneurysm is healing.
While spending time in the RUH hospital, neuro ward, we have witnessed countless lives being saved, including my own, by this team of talented doctors and nurses.
Please help them save more lives so that they can give more time to the families that need their husbands and daddies. Thank you.
Thanks.
Join other donors to support the programming, research, and trauma care that stroke patients require. Make your donation today to the Royal University Hospital Foundation.